Hello, this presentation is entitled NIH Public Access Requirement. Content from this presentation was originally developed by NIH staff Katie Funk, Neil Thakur, and Bart Trawick. Today, the presentation will be given by Erin Bailey, the Chief Financial Officer for the University at Buffalo's Clinical and Translational Science Institute, and Erin O'Byrne, the UB's Clinical and Translational Science Institute Senior Research Administrator. Throughout the presentation, we will cover the NIH Public Access Policy and how is it applicable to the University of Buffalo investigators. We will take a look at how to comply following the 4 methods and consider some frequently asked questions pertaining to following the policy. The NIH Public Access Policy is mandatory to all investigators funded by the National Institutes of Health. The policy states that those investigators are required to submit an electronic version of their final peer-reviewed manuscript upon acceptance of the publication to be made publicly available no later than 12 months after the official date of publication. The policy applies to any final peer-reviewed manuscript published on or after April 7th, 2008, and arises from NIH funding inclusive of a grant or cooperative agreement active in fiscal year 2008 or beyond, direct funding from an NIH signed contract on or after April 7th, 2008, direct funding from the NIH intramural program or an NIH employee.
In order to comply with the policy, an applicable paper must be submitted to PubMed Central, or PMC. There are 2 ways a paper can get into PMC. Either the final published version of the article is directly deposited by the publisher, or the peer-reviewed accepted manuscript goes through the NIH Manuscript Submission system. In both cases, the article will be assigned a unique identifier, a PMC ID, when it is loaded to PMC. It is important to note the difference between PubMed and PubMed Central. PubMed is a database of citations and abstracts from various literature, journals, and online books. PubMed citations often include links to the full-text article on the publisher's website and/or in PMC. The unique identifier for those in PubMed is PMID. PubMed Central is a free digital repository that archives the open access full-text published work deposited by participating publishers and accepted author manuscripts that are submitted to be in compliance with the policy. As noted on the previous slide, the PMC identifier for each full-text paper is a PMC ID. A PMC ID provides evidence of compliance. In planning your NIH-supported paper, it will be important to consider which submission method will be used, who will submit the paper and when, who will approve the submission, and what version of the paper will be used and when will it be made public. Authors should work with the publisher before any rights are transferred to ensure all conditions of the NIH public access policy can be met.
There are 4 methods to ensure an applicable paper is submitted to PMC in compliance with the policy. Authors may use whichever method is most appropriate for them and consistent with their publishing agreement. When a journal is responsible for depositing the NIH-funded article with no author involvement, this falls under Method A. It is the responsibility of the author to track the paper and ensure compliance no later than 12 months after the publication. Method B publishers and journals are those that have an agreement with NIH to post individual final published articles in PMC on a case-by-case basis. These journals do not post every NIH-funded paper in PMC. Instead, the author works with the journal to select a fee-based open access option for publishing. It is responsibility of the author to track the paper and ensure compliance, again, no later than 12 months after publication. Methods C and D are similar in that they have the responsibility of the authors and awardees to ensure the final peer-reviewed manuscript is deposited into the NIH Manuscript System, also known as NIHMS, upon acceptance for publication. Under method C, the author or a delegate deposits the final peer-reviewed manuscript into the NIHMS system. Under method D, the publisher deposits the final peer-reviewed manuscript into the NIHMS system. The assigned author in the NIHMS system will be responsible for completing all steps for a citation to be assigned a PMC ID. It is important to note that the timeline to ensure compliance with the policy begins when the paper is first accepted for publication.
The NIHMS system will facilitate the submission of peer-reviewed manuscripts for inclusion on PMC in support of the policy. Depositing a manuscript in NIHMS for inclusion in PMC is a multi-step process, requiring an author to approve the deposited files and associated funding. As briefly mentioned on the previous slide, there are responsibilities of different parties throughout the NIHMS process, depending on the method being followed. As a majority of papers get processed in NIHMS, it's good practice to search a paper's status. While you don't have to be associated with a manuscript to view a status in NIHMS, you do need at least a MyNCB account to log in. For anyone submitting an application, proposal, or report to NIH, a PMC ID must be included when citing applicable papers that arise from NIH-funded research. For non-competing continuation awards with a start date of July 1, 2013 or later, MyNCBI is used to report compliant papers in the Research Performance Progress Report, or RPPR. It is important to note that awards will be placed on hold until grantees have demonstrated compliance in publications consistent with the public access policy. The NIH grants policy statement outlines requirements for acknowledging federal funding in research publications. However, again, if a publication is not compliant, it can delay funding of an award until compliance is met. As the University at Buffalo is a recipient of an NIH Clinical and Translational Science Award, or CTSA, it is also the responsibility of UB investigators to acknowledge the award for using resources supported by the CTSA. Publications must be compliant before linking to the CTSA. The NIH Clinical and Translational Science Award, the CTSA, is a cooperative agreement that provides broad-based support to clinical and translational research. If you have used any of the services or resources bulleted on this page, you are required to cite the CTSA.
Some common important questions may arise in maintaining compliance with the public access policy. One instance might be having an unwanted citation associated with your award. Generally, one should be able to disassociate it in the PI's My Bibliography account. Here, there will be an option to add or delete an award and unselect the award in question. In the event an unwanted publication associated with the award gets officially reported in an RPPR, a silver lock will display next to the publication. For assistance in deleting a citation with a silver lock, one will need to request a revision to the progress report by contacting the program officer, who will need to contact the Public Access Support Center to confirm the changes. A gold lock indicates that the award was associated with the publication through NIHMS. A gold lock cannot be removed from the RPPR once the RPPR has been submitted. For assistance with deleting a citation with a gold lock, one would need to contact the NIHMS help desk. When a publication is stalled, that means it has not yet received a PMC ID number and it's linked to the award. What should you do when you're unable to get hold of the author of the publication? If a publication becomes stalled, the PI or a named alternate reviewer can contact NIHMS to claim the manuscript. The assigned reviewer has 30 days to respond to the request. If there is no response, the PI will take control and will be able to move the manuscript forward. Finally, is there a time limit on how long after receiving an award that I need to continue citing the award? The answer to this is there really is not a time limit. Any publication that uses data derived from the award is required to cite that particular award. The remaining few slides include helpful resources for maintaining compliance of the NIH Public Access Policy. Thank you for your time and learning about this topic.